Hello. Welcome to a brand new community health nursing lesson. My name is Jessie Wheatley and I'll be facilitating this lesson. Please make sure you have your notes in your notebook ready so you can follow along with this lesson. Thank you for listening to this lesson. This lesson covers community assessment and evaluation. By the end of this lesson, you should be able to decide whether nursing practice is community oriented. You should be able to understand selected concepts basic to community oriented nursing practice. You should be able to understand concepts like community, community client, community health, and partnership for health. You should be able to compare the nursing process to community-oriented nursing practice, and you should decide which methods of assessment, intervention, and evaluation are most appropriate for any selected situation. You should be able to develop a community-oriented nursing plan. So what is a community? We have discussed what a community is in previous lessons, but a community is defined as a locally based entity composed of systems of formal organizations reflecting society institutions, informal groups, and aggregates that are interdependent and whose function or expressed intent is to meet wide variety of collective needs. A community practice setting is insufficient reason for saying that practice is oriented to the community client. What does that mean? What I'm saying is just because a nurse is functioning and practicing in the community, it does not really mean that their practice is oriented towards a community as a client. So we think about the community as a client as we think about the community being a patient. When the location of the practice is in the community, but the focus of the practice is individual or families, the nursing client remains an individual or family, not the whole community. So you're going to have to look at people collectively as a client for you to be able to say that you have a community practice that is community oriented. Let us now expand more on this thought of community as a client. Community-oriented practice is targeted to the community, the population group in which healthful change is sought. Remember that, we talked about that. Why bother with people who do not want to change? This is a question you get over and over from people. Change for the benefit of the community client often must occur at several levels. Remember that we're not worried about one person and what one person thinks. We're thinking about the whole gamut. So ranging from the individual to the society as a whole. So just because one person is failing us doesn't mean that we give up on the community as the client. Lifestyle-induced health problems cannot simply be solved simply by asking or encouraging individuals to choose health-promoting habits. Society also must provide healthy choices. What does this mean especially? I want you to think about your patient. What happens if their respiratory system fails? Do you give up on them because their respiratory system fails, or do you continue? So just because an individual or one system of a community is not working doesn't mean that we shouldn't even try. So there's going to be a lot of questions about that. Remember that the society must provide healthy choices for people to have in order for you to make the change. So that's just you promoting health and wellness. Most individuals cannot change their habits alone. They require the support of family members, friends, community health systems, and relevant social policies. So when you look at community as a client, you're going to be looking at it from a bigger scope than one individual. Now that we understand that we're going to be looking at the whole community, community health, as used in this lesson, is defined as the meeting of collective needs through identifying problems and managing interactions within the community itself and between the community and the larger society. Most changes are aimed at improving community health and of necessity, partnerships among community residents and healthcare workers from a variety of disciplines. Community health, when viewed from this structure of community, is usually defined in terms of community characteristics, as well as services and resources. And indicators used to measure community health services and resources include service use patterns, treatment data from various health agencies, and provider-client ratios. This is why you're going to be asked to complete a windshield survey. It's pretty much a general inventory of what you have going on that's going to need assessing. So that's the first step you're going to do, is the windshield survey. Well, now that we have identified our patient or our client being the community itself, we're going to talk about how we're going to apply the nursing process to this client, which is going to be something similar to what you already know, but it's going to be unique in the magnitude of our client. The first thing we do with the nursing process is assessing. In assessing the community health, it requires you gather data that's existing, you generate any missing data, you interpret the database. 5 methods of collecting data in the community could be through informant interviews, participant observations, secondary analysis of existing data, surveys, and windshield surveys are great ways to gather data. So for this class, you will gather data using a windshield survey. Gaining entry or acceptance into a community is perhaps one of the greatest challenge in assessment, just like it is with somebody you meet for the first time. Just being accepted and understood. The nurse is usually an outsider and often represents an established healthcare system that is neither known or nor trusted to community members who may react indifferent or even act with hostility. So it's important for the community health nurse to know that. Okay, so how do you go about assessing the status of a community's health? The status of a community health involves physical indicators measured by traditional morbidity and mortality rates. You can look at life expectancy indices. You can look at risk factor profiles. So vital statistics are measures of community health status. The healthcare manpower, which is us and the physicians and other disciplines, and health facilities, which is hospitals and clinics, are measures of community health structure. So you can look at how many things are available as far as healthcare manpower is concerned to be able to tell if the community health status will work. Community awareness is a measure of the process. Okay, you may ask me, why gather all this data first? Just why don't we have to do that? Many sources of data are readily available and useful for secondary analysis. So you really need to look at data as you look at the community in the nursing process. And it saves you time and effort. Time and effort are important. The next step in the nursing process is planning. The planning phase includes analyzing and establishing priorities among community health problems that have been identified. You're going to establish goals and objectives, and you're going to identify intervention activities that you're going to be implementing to accomplish those objectives. Okay. Also, another important factor is that evaluation begins in the planning phase as well. When the goals and measurable objectives are established and goal-attaining activities are identified, then you really need to think about how you're going to evaluate that they work. Okay, so once high priority problems are identified, you want to go ahead and broad relevant goals and objectives should be developed right after, and you should already have a plan on how you're going to evaluate them. How do I prioritize? Okay, the choice of priority must depend on the community's awareness of the problem, which is a little bit differently here, and their motivation to improve it. So you're going to prioritize based on how well are we going to make changes on this. Other bases for choosing include determining which individuals would be most affected. That's another way to prioritize. What benefits to the community would result. That's another way to prioritize. What might happen if the problem is not solved. How much it must cost to get that, and because you know cost is very important in this. The opposition to the problems seem likely based on community values and priorities. You want to make sure that really what you're going to do to intervene is going to fit the community you're trying to intervene for. Remember that the goal is generally a broad statement with desired outcomes and objectives. The precise statements, the objectives are the precise statement of the desired outcome. So these should be carefully selected. Okay, so objectives must be precise, they should be behavior oriented, and they should be measurable. An example of an objective is that of all the students enrolled in the ASN hybrid cohort, I want 100% to pass the ASN 240 by the end of the semester block. That's something that could be considered a measurable objective. Okay, the next thing I want to talk about is implementation, part of the nursing process. Intervention activities that the means by which objectives are met are strategies that clarify what must be done to achieve the objectives, the ways the change will be affected, and the ways the problem will be interpreted. Implementation is the third phase in the nursing process, as you may well know that already, is transforming a plan for improved community health into an achieved goal and objectives. This is when you're actually going to do something about it. Okay. Remember that nurses' roles in implementation carries different meaning in community health. The nurse can either be a change agent or the nurse can be a change partner. Right here. Okay. Can be either a change agent or a change partner. Content-focused roles are often considered change agent roles, whereas the process roles are considered the change partner. Change agent roles stress gathering and analyzing facts and implementing programs, whereas the change partner roles include those that are enabler, catalyst, teacher, or problem solver, an activist and advocate. The nurse is more involved when they're being a change partner. The change agent, the nurse, is just supporting and advocating and empowering that community so they can make the right decisions. So when you're just empowering and gathering data and analyzing facts for them and implementing those programs, you're more of a change agent. But when you're being a partner in that, you're the teacher, you're the activist, you're the problem solver, you're the catalyst, and you're the enabler. Okay? The nurse establishes an elder care center is acting as a change agent because the nurse actually is not going to be the one that runs it. The nurses administering vaccines and analyzing community health needs are they're going to be the change partner. Okay. The last stage in the nursing process is evaluation. So we're also going to want to make sure that we evaluate what we're doing in the community. Remember, evaluation is the appraisal of the effects of what we're doing and see how well it's working. Not all communities are open to change. The ability to change is often related to the extent in which a community focuses on traditional norms. So if a community is more traditional, they're less likely to change, especially if the change is a bigger change. The ability to change is often directly related to higher socioeconomic status, a perceived need for change. That you have to have buy-in with the changes you're trying to implement, just like you do with your patients. The presence of a liberal or scientific and democratic values, a high level of social participation by community residents is also a good sign that they may be willing to change. Thank you for listening into this lesson. I hope you have enjoyed this overview of community assessment and evaluations. For questions about this lesson or corresponding notes, please feel free to email me. Have a lovely day.